Hello everyone, welcome to this NABH training session. Today we are going to discuss a very important and frequently asked standard. PRE.1, Patient and Family Rights and Responsibilities. This standard is not just about documentation, it is about how we treat patients, how we respect them, and how we ensure their dignity and safety. In this session, I will explain each objective element in detail, what exactly NABH expects, practical implementation in hospitals, common non-conformities and how to close them. So let's begin. Standard overview. PRE.1 states, the organization protects and promotes patient and family rights and informs them about their responsibilities during care. Now let me simplify this for you. Patients must know their rights, families must understand their responsibilities, staff must protect these rights at all times. This is a patient-centric standard, and it reflects the ethical foundation of healthcare. Objective elements. Let's start with the first element. Patient and family rights and responsibilities are documented, displayed, and communicated. What does NABH expect? First, documentation. The hospital must have a written policy on patient rights and responsibilities. This must be aligned with the National Charter of Patient Rights, NHA or statutory body. Second, display. Rights and responsibilities must be displayed in OPD areas, IPD wards, reception, billing areas. Display should be clearly visible, readable, not hidden behind counters. Third, communication. Patients must be informed actively. Use, pamphlets, booklets, IEC materials. Must be at least bilingual, for example, English and Hindi. Practical example, at the time of admission, the patient receives a leaflet explaining right to information, right to consent, responsibility to follow treatment. This completes documentation, display, communication. Now let's move to the second element. Patient and family rights and responsibilities are actively promoted. This is very important. Displaying information is passive. NABH expects active promotion. What does active promotion mean? For inpatients, IPD, admission counseling must include rights and responsibilities. This counseling should be documented. For outpatients, OPD, posters, digital screens, easily accessible brochures. Communication should be in simple language. In a language the patient understands. Practical example. A nurse explains during admission. You have the right to know your treatment plan, and you are responsible for following instructions. If this is documented, compliance is strong. Now we come to a core requirement, meaning it is mandatory and critical. The organization protects patient and family rights. What does this actually mean? This is about staff behavior and hospital practices. Staff must be trained regularly, staff must demonstrate respectful behavior. Areas to ensure protection, privacy, use curtains during examination, avoid unnecessary exposure, confidentiality, do not share patient information without consent, protect medical records. Respect for culture and beliefs, respect religious practices, no discrimination, dignity, no rude behavior, proper communication. Example, female patient examined in presence of female staff. Patient details not discussed in public areas. Protection is not on paper, it is visible in daily practice. Next core element, reporting of violation of rights. The organization must have a mechanism to report violations. What is required? A defined system to report violations. Staff must know what constitutes a violation. Examples of violations: breach of privacy, breach of confidentiality, disrespectful behavior, delay in providing medical records. Mechanism should include incident reporting form, patient complaint system, feedback forms including rights-related questions. Patients and families must also be able to report. Example, patient complaints. My privacy was not maintained during dressing. Staff fills incident report and investigation starts. Final element, again a core requirement, violations must be monitored, analyzed, and corrective actions taken. What does NABH expect? All violations must be documented, investigated, perform, root cause analysis, RCA, implement, corrective action, preventive action, define, timeline for closure, review by quality team, top management. Example, repeated complaints about lack of privacy, RCA shows no curtains. Action, install curtains and train staff. This is called a closed-loop system. Common NABH, non-CONFORMITIES. Now let's discuss the most important part, what mistakes hospitals commonly make. Rights not in bilingual format. Only English displayed. Solution. Use English and local language, Hindi, ensure readability. Staff not aware. Staff cannot answer basic questions. Solution. Conduct regular training, include in induction, do mock drills. No evidence of patient education. No proof of counseling. Solution. Add checklist in admission form, take patient signature. No defined violation criteria. Staff unclear about violations. Solution. Create defined list, display internally, train staff. Complaints not converted into incidents. Issues reported but not documented. Solution. Strengthen incident reporting system, encourage reporting culture. No kappa or repeat issues. Same issue repeated. Solution. Do RCA, implement kappa, monitor effectiveness. Final summary. To summarize, PRE.1 is about respect, dignity, and awareness. Not just documentation, but implementation. Staff behavior is the key. Monitoring and continuous improvement is essential. If you implement this standard properly, patient satisfaction improves, complaints reduce, NABH compliance becomes strong. In the next video of this NABH training series, we will discuss PRE2 respecting patient beliefs, privacy, consent or participation in care. If you found this session useful, like the video, share with your colleagues, subscribe for more NABH training sessions. This is MediQuality Partners, your trusted NABH guide. Thank you for watching.